Hi. So my opponent mentioned how animal testing was unethical and cruel, and she started to explain the AWA, the act that helps protect the animals. But there's also a bunch of other committees that other facilities can go to. From the Americans for Medical Progress, it told us that all proposals to use animals for research must be approved by an institutional animal care and use committee, the ACU, and set up each research facility. And they go and inspect those facilities, and the humane treatment is enforced by each facility's IACU. And the most major research institution programs are voluntarily reviewed for humane practices, so that means that they invite the inspectors to come and inspect their facility. And then also, there's also a monetary incentive to comply to these standards. By the Animal Welfare Act, all institutions receiving funding from the U.S. Public Health Services must comply with the PHS policy on humane care and use of laboratory animals. So it wouldn't really make any sense for a facility not to comply, because they're basically getting money from the act to make sure they uphold those standards. So I don't really see how a facility can be unethical if they're getting paid money to stay ethical. Going on to her second point about how it's torture, and that animals might not be adequate subjects for this type of research. And she already mentioned how animals are similar genetically, but we also use animal cells to actually help us. So if animal cells actually heal us, how can we not test on their own cells to see if they're if medicine for them is the same for us? From the website Understanding Animal Research, Herceptin, a humanized mouse protein, has helped to increase the survival rate of those with breast cancer, and it would not have been attained without animal research in mice. And then also, the development of taxoxamine in animals led to a 30% fall in death rates from breast cancers in the 1990s. And lastly, in a new breaking field biotechnology, the Chinese hamster ovarian cell is the workhorse behind this whole industry. And essentially, this cell is modified so that we can put it into human bodies and have it start healing us. So the fact that animals might not be adequate subjects is, I can't really see a conclusion. I can't really see how that could be necessarily true when we use their cells to actually heal us. So if their cells can respond to our body the same way, the medicine should be the same way. And then she also mentioned how the tests are ineffective, and she mentioned how about 92% of these tests fail. And this animal testing method, this animal testing statistic is true, but I feel like it is misunderstood. Also from the website Understanding Animal Research, consider that all the drugs which pass phase 1 clinical trials in humans, 86% will fail in a later stage of human trials. Yet we do not hear activists suggesting that humans are entirely inappropriate models for drug development. So after it already goes past the animal phase, 86% of those drugs will fail in the human trials. So you can't really say that animals aren't the reasons for this, but also humans have the drugs fail in the human trials as well. And so contrary to animal rights claims or alternative methods being better, the truth is that 94% of drugs that pass animal tests and non-animal preclinical tests will fail in human tests. So rather than damn just the animal tests, have human rights activists managed to damn all the preclinical research? In short, no. And this is because this process of clinical trials is actually to narrow down the most effective drug to send to the market. And then lastly, from the California Biomedical Research Association, it is said that it states that nearly every medical breakthrough in the last 100 years has resulted directly from animal research on animals. So I can't really see how animals would not be an effective test method to formulate these new drugs. And then lastly, going on to her fourth point about the alternative testing, nothing else can really replicate a whole body system. Yes, there is in vitro testing where they just do the cells, and then there's other parts where they can do a computer model, but there's nothing else that can really replicate a whole body system, because from the California Biomedical Research Association, it says that living systems like human beings and animals are extremely complex. Studying cell cultures in a petri dish, while sometimes useful, does not provide the opportunity to study the interrelated processes occurring in the central nervous system, endocrine system, and immune system. So we all have all these systems working together in unison, and it's extremely hard to test to see if our drugs that we're making will actually be effective if we just do it on a single cell which isn't connected to any other system in our body. And then going on to another point, that other testing other testing methods can't evaluate side effects. So if you test it on a cell, the cell's not going to throw up or have diarrhea or stuffy nose or turn purple or something. So evaluating drugs from side effects requires a whole body to basically see what will happen, and animals and humans will relate together according to Kara Rogers. And this is from another testing, the Understanding Your Testing, research.com. And also, animals make better research subjects because of their shorter life cycles. So as they're testing these new drugs, like laboratory mice, for example, live only for 2 or 3 years. So researchers can study the effects of genetic manipulation over a whole lifespan and across several generations, which would be totally impossible to do for your human and possibly extremely unethical to kill multiple people to just understand that. So the animals we use with the short lifespans, they give us foresight into the future of how it can affect us with these medicines. And that's all I have. Thank you.